Now, the Vice President of the Republic of Ghana, Dr. Mahmoud Bamia, today launched the very first ever drone delivery service in Ghana. Of course, we are told this is the largest of such delivery network in the world. This happened at Omenako near Suhum in the eastern region. In fact, the project is named the Fly to Save a Life project. Indeed, this is a collaboration between the Ministry of Health and also Zipline Technologies. You do recall that not long ago, when the introduction of this particular project happened, there was massive opposition and massive furore. Today, one or perhaps the biggest critic of the entire project is my guest today. He has extraordinary competence in procurement and all the related matters. He will do the more critique of the project and be asking the questions. The same man asked almost 17, 16 or 18 questions early on. These questions, have they been answered? Have they gotten to the bottom of the matter as we roll out this service earlier today? Now, the Omenako Center is the first of four, we are told. What else are we told? We are told that they will be working out some unmanned drones to supply 12 routines and emergency service, as well as some 148 life-saving medical products, which has been selected by the Ministry of Health. Sounds like a good idea, but do the details support this good idea? Now, I'll go to the phone lines now and speak to Daniel Mafo. He represents Zipline Technologies. That is the institution responsible for running this particular process and drone delivery service. If you can hear me, Daniel, you're welcome to UPfront. If I can hear you, Daniel, you're welcome to UPfront.
Thank you very much.
So, was it a successful day that you brought what you consider to be the largest drone delivery service of medical related matters in this country? That's it, right?
Yes, today we saw the successful launch of the first distribution center of the largest unmanned drone center in the world. So it's not in Ghana, but in the world.
That's quite...
we hope...
Please proceed.
Pardon?
I was only saying it's quite fascinating. Yeah, please proceed.
Yes. And we have a mandate to build 3 extra of these centers across Ghana, and that is our main goal and mission now.
Now, let me get to some more appreciation of this. Have we now identified that it's only 148 medical supplies that will be using this emergency service?
Yes, so we have a list of 148 health commodities, which include blood products, emergency medical products, vaccines, and some program drugs that we have been mandated by the Ministry of Health to deliver to the many facilities that cut across from CHIFS compounds to health centers, district hospitals, and regional hospitals.
This would include vaccines, wouldn't it?
Yes.
But vaccines necessarily might not be an emergency, what they call a drug delivery thing.
Well, that is a very interesting point. But what you need to bear in mind is that vaccination, how we view it, is necessary for every child. And if a child does not get vaccinated, they can develop life-threatening conditions like polio.
Except to say that we plan ahead of time to always do vaccines. I mean, we know that which time of the year, which month you are going to do this. I'm saying that the delivery of vaccines to part of the country really is not an emergency thing. Is it?
Yes, I understand where you are coming from. But what you need to bear in mind is that vaccines by themselves are what we call cold chain products. They need to be maintained in a very cold environment. And so if you're doing vaccines to places that we describe generally as hard to reach, where motorbikes do not even get to easily, or cars, the cold chain will break, and that's making the vaccine useless. So in those cases, you need to get the vaccine to the destination as quickly as possible to make sure that the vaccine is actually active. So that is where drone technology can make vaccines to reach the people who need them in very hard to reach areas whilst its efficacy is still intact. Very necessary.
Now, let me understand this. There's been a lot of talk about the cost involved in all of that. Now, what is the cost per flight in this arrangement?
We do not charge cost per flight. What I do know is that at our maximum capacity, when we are flying 150 flights per day per distribution center, that is the average. If we're doing an average of 150 flights per day per distribution center, our cost is $80,000 for daytime, plus an extra $8,000 for nighttime. But what you have to bear in mind is this is $88,000 for 504 facilities. So even if you did a simple division for an unlimited number of emergency deliveries, any point of the day, to any of the 504 facilities, if you did the division, that will come to $176 per month per facility. And that is how you should be looking at it. Look at this as an insurance policy, that anytime that anything happened, you could get products delivered to you for $176 a month. If I ask someone in Eche, just across their farm plains, to come to Accra to pick up a medical product on their own, they would spend more than 300-400 cedis easily. But for $176, you could have that unlimited delivery per month. So that is how we view it, and that is how the costing is done.
Clearly too. So why in the world that you have deployed the system do you do 150 deliveries per month, per day?
Well, so currently we've deployed this technology in Rwanda, and Rwanda is allowing us to scale very quickly to other health, other health facilities. In Rwanda, we are currently doing very high numbers, not as high as what we are hoping to achieve in Ghana, because Rwanda is a much smaller country with a much smaller population and land mass, so we are not doing those number of deliveries. But during testing of our system, we've done in excess of 150 flights per day. So this is not conjecture.
So you did it here in Ghana? Because your average in Rwanda is way below the 150.
No, that's not what I'm saying. During testing, we test our technology rigorously before we deploy them in country.
I see, I hear.
At our base in California. So at our base in California, we've done more than 150, 60 flights per day. That is what I am saying.
I mean, we understand that this equipment can only do 80 kilometers, right?
It's an 80-kilometer radius. So it does 160 kilometers in and out combined.
So
but what you have to bear in mind is that 80 kilometers in the air is not 80 kilometers on the ground.
I see.
So your 80 kilometers by air, we take it that we are going in straight lines. So do not confuse it with 80 kilometers on the ground where you are driving through curves and corners. It doesn't come to the same.
I get your point. From Omenako, can you do delivery to Afram Plains?
Yes, we can actually do deliveries to parts of the Afram Plains from Omenako. And we've actually, so in fact,
and that's within your 80?
A flight to Afram Plains, I will let you be aware of it.
And that's within your 80 in this case? That's what I'm saying?
Yes, it's within our 80.
Okay, now let me also understand the... Hello?
Yes, I'm here.
If you can hear me, Daniel, the understanding many got from this is that, well, the people in hard-to-reach areas and the kind of things that they would need is also problematic. For example, is it the understanding of the arrangement you have that you'd be supplying blood to, let's say, CHIP compounds?
No, let us not make mistakes here, and let us stick to the facts. CHIPS compounds do not administer blood to anyone. We are sitting within the mandate of the Ghana Health, the Ministry of Health and the structure. As per the structure of the Ministry of, it's only a health facility with a medical doctor that can administer blood.
That's like a district hospital, right?
That is a district hospital or a health center where there's a medical doctor. So what our system does is that we have all the facilities tagged by that order. So even if a health facility below this, let's say a CHIPS compound, tries to place an order for blood, even in our system, we can't fulfill it. Because the Ministry of Health and the Ghana Health Service standards, a health facility without a medical officer cannot receive blood. So we are not veering into the unknown here.
Even though that probably might be a hard-to-reach area.
It might be a hard-to-reach area, but we are also mandated to work within the laws. And so we cannot just go rogue and do anything we like.
When will we see full deployment and building of all the other centers so that those in Tumu and those in Karachi can all have your services immediately?
We will have all the remaining 3 centers completed before the end of the year.
Is there a date?
I can commit that in the last quarter would launch all 3. So that is what I can commit to now. We are working aggressively on our timelines to ensure that in the last quarter of this year, we can have all the 3 distribution centers up and running.
I'm grateful to you for your time spent with us here today, and I appreciate your time, sir.
Thank you, sir. Thank you, sir.
Daniel Marfo is General Manager of Zipline, the company that's actually deploying these drones. Today was launched by the Vice President. Now, let's take a listen to some of the things that the Vice President of the Republic of Ghana told us at this particular event.
And we should all make sure we register. The introduction of the national ID system is to give every Ghanaian a unique identity so that from childhood to your retirement, you will be known and you can have access to or benefit from all kinds of services. And with the introduction of the digital address system, we will also know where to find you. We have also used technology to deepen our strategy of inclusiveness in the financial system. So many people were deprived of financial services. But now with your mobile phone, you can transfer and receive money through your mobile money account, through your mobile wallet, and through a bank. There's interoperability now. Ghanaians have joined the financial inclusion revolution. The excitement, however, today, as we are here in Omenako, is for 2 reasons. First, we are using technology to increase the access of Ghanaians to one of the basic public services that every citizen deserves. Second, we are using technology to solve a major problem in our health delivery service to those in remote areas that cannot be reached easily by roads. If you have to get to the Dwarf Islands on Afram Plains, standing from here today, and someone needs medicine on one of the Dwarf Islands in Afram Plains, just think of how long you will take to get that medicine to that person. We can now prevent the death of the mother in labor in these deprived areas who needs blood. We can now deliver critical medicine like snake serum to regional and district hospitals in the shortest possible time.
That's the Vice President of the Republic of Ghana. Now, there's also another interesting commentary from the Ochene on this particular drone delivery system. We'll hear briefly from that. Come back in studio here and speak to Kobina Ata-Bedu, who spent quality time reviewing the contract and many elements of this particular deal to find out if this is the best deal we could actually get at this time. So let's first hear the Ochene.
He said, among other things, that this will be the greatest, largest in Africa, maybe in the world. This is going to change our lives. But one thing also is the machines, the drones, the technology are not going to do it by themselves. We need people who are going to be committed. That has been the problem of our country. Committed workforce. Genuine, sincere people who work to make this thing work. Talk about Tafu when they dropped the vaccine in the blood. I'm trusting that the nurse who took it brought it where she was supposed to bring it, used it for what she was supposed to use it for, and a life was saved. There are people who are sitting here today who may be hearing us will think, well, we're going to disrupt this by stealing the blood. The blood will never get to the table where the doctors need them. In this country, a whole drug warehouse in Tema disappeared. Let me say it in tree. Nia ompen kasuo biano oye nipa boni ebe ifo. Adie se ya ebe onipa bi ebe se no. Na ye makwan.
So that is your chain there. Early on, you heard the Vice President, Dr. Mahmoud Bawumia, also extolling the wonderful things that we are told this particular drone service, which was launched today. The controversial part being somewhat dealt with earlier. Now, let me come in studio. I did tell you that my guest is an expert in procurement. He's also very competent in some of these deals and how it's supposed to run. Kobina Ata-Bedu, you're welcome, sir.
Thank you very much.
I hope you are doing well this day.
I'm very fine.
Biggest, largest in the world, revolutionary, life-saving technology that's going to change how we live our lives. You think so?
Yes, drone technologies are going to change not just how we live our lives, but even the commercial world. As a matter of fact, just this week, Wings Aviation, which is a subsidiary of Alphabet, that's the parent company of Google, has been given the first approval to fly in the US. And that is going to change the way things happen in the US. Fly, yes. Drones.
Okay, but that would be significantly different from doing test trials.
That is different from doing test trials. So a number of drone companies are
Daniel Marfo did tell us
doing trials in the US. No one has the license to operate. It is just this week that Wings Aviation was given the license to operate, and it not only in the whole of US. It's only in a part of Virginia.
Okay, that's interesting to know. Now let's get to some of the issues you have raised before. I mean, first and foremost, you concentrated much on the details, especially when it comes to exactly how much are we paying for this, exactly what's this supposed to be to our benefit as a people. You raised the issue about cost and the unit price. I asked Daniel Marfo whether or not the cost per flight was going to be what they call it in this case. He says no, they're not doing cost per flight. They have a different arrangement, and it ranges between the 150 and also something lower than that.
Okay, so why I got into all this was that I was listening to the news and I heard Dr. Nsiansari speak, and he mentioned that we're going to have 5 stations, and we're going to do 150 flights per day, and then so for the 4, it means it was going to be 600 per day. Yeah, and it was going to cost us $12.5 million over a 4-year period. Yeah. So I took my calculator and I did a calculation. Divide 12.5 million over 48 months and divide it. And actually the unit cost should be, on average, should be about $14. So I was wondering where his 17 came from. Okay. So I was immediately thinking, is this an arithmetic error or not? So I started probing. So I asked for a copy of the contract to review it. And then I asked myself again, 600 deliveries a day. That presupposes that our cold chain management has collapsed. It means we are not moving any drugs, because normally in a cold chain management system, the drugs must move from point A to point B in a refrigerated vehicle or equipment, and they must be stored in a refrigerated environment. So if you are going to be shuffling about 600 flights a day, then it means the various health facilities do not have any drugs in stock. And that is not how to run a hospital. And that was where my antennas went up and I began to wonder what happened. So I called for a copy of the contract. I got one and I began to review it. And then I saw a lot of things that were not consistent with normal procurement practice. And that is when I got worried.
Okay, so we will go into those inconsistencies with the normal procurement practice and seek to understand exactly what do they mean in this case. First, you raise a concern about inconsistencies, which is in clause 3, sometimes read together with the definition of the service period, and this is still the term. One section is counting the start date from the date of parliamentary assent. Another is starting from phase 1, which is supposedly a much later date. And of course, phase 1, we understand is starting now.
So when you go to the definitions of the contract, you'd find all these dates: execution date, start date, service date, and all that. And we all know that Parliament approved it on December 12, 2018. Yeah. And so if you count forward, 4 years should end December 11, 2022. But operationally, they are starting today. Yeah. So is this contract starting today, or it is starting in December when it was signed? Okay. That is where the inconsistency is. And that is why I raised the comment that, listen, if we don't fix this, then we'll have a problem down the line. Because by the time the contract should be ending, we'll be wondering whether it should be date A or date B. It hasn't been cured.
Well, that's interesting to know. You also mentioned the delivery time. You also, but yeah, you did mention that it hasn't been killed.
Not that I know of.
Yes.
So that is a point I highlighted in my analysis, that this is a material clause of the agreement which is incoherent and is going to potentially be a point of dispute if you want to consider termination. Because if you decide that you don't want to do this anymore, probably you don't want any judgment there, so you want the contract to lapse. The date it should lapse is December 11, 2022. But if we are counting it from the date it went first operations today, then it means it will have an extra 4 months on its life.
Why is this important?
It is important because when you sign any contract, you need to know when you are starting and when you are ending. Where you are ending should not be grey.
It does not necessarily come to anybody that is when you start your real operations, that's when you are starting?
No, not necessarily. The contract is the effective date. The effective date is the date Parliament approved it.
Okay. And between that time, it will be believed that many other things related to the building and other things have actually started.
So our commitment and our liability started on the effective date.
So this is like some 4 extra months, right?
That's 4 extra months, yes.
Okay, well, it's interesting to know that. You also mentioned the issue of delivery time being important. Of course, I mean, you say that it's important in the service because there are no penalties for this performance measure.
Yes, so you would, for any service, you would expect that the service provider has a set of KPIs that he is working with. In this contract, they are not giving any KPIs. There's no specified delivery time.
Would it be delivered later? Does it look like it'll have to be delivered later?
Okay, so for any service, you must have an uptime of 99.9%.
Okay.
When you cut slack for maintenance and stuff like that, you can allow for 99.5 or sometimes 99%. This one doesn't have anything at all.
So we're saying that there are no key performance indicators?
There are no key performance indicators.
Whether, and of course, they have to deliver, right?
Yes.
Whether they deliver on time, later, much more later.
There's nothing here that says that it will be punished for anything.
So how do we monitor whether they did the job that they're supposed to do?
I don't know. I think there are reports that they have to present, so they'll present reports. Okay. But the fact is this: you need to set KPIs for every performance, and you measure the performance against the KPIs you set.
This is particularly important because the entire conversation is about fast delivery of essential drugs and other things.
Exactly.
So if they are not able to meet timing, that's relevant in this particular
And if they don't meet it, what happens to them? There's nothing.
I see. Now, the element of insurance, exactly what's your claim about that?
Okay. So, I mentioned here that I find it intriguing that the state is not able to state the type of insurance and the minimum sum assured. So there's no, for a contract of this kind, normally you would require that you must have this kind of insurance, and that kind of insurance, and that kind of insurance. And you are supposed to maintain a minimum of this level of sum assured in the event of an incident. So for example, if the drone drops from the sky and it falls on someone on his farm, what is going to be the compensation for that person who got injured?
And who's going to pay for it?
And who is going to pay for it? Normally, an insurance policy would ensure that if this happens, and it is possible for it to happen the way technically it is designed to work. So something like this can happen, which is a risk. And this contract doesn't have any form of risk mitigation. It doesn't have any business continuity plan. It doesn't have any risk matrix or risk assessment done to it. There are no provisions for that.
Let's break it down. What's risk mitigation?
Okay, so for any technology contracting, you want to make sure that you are covering disaster management and there's business continuity, so there's a plan B. Okay. So if this fails, this should be able to kick in. Okay. So for example, if I set up a data center, or for every telco you know in this country, they have a network that is actively working, but they have exactly the same network sitting down redundant. Okay. So that if something happens and this one goes down, you switch to this one, so service is not disrupted. Okay. In a technology contract of this kind, there must always be a plan B, that you have a redundant system. There's no requirement for a redundant system in this contract.
Not at all.
Not at all.
Is it because we trust that it is actually foolproof and we will not have the difficulties that others have had in times past? This is the biggest in the world, you know.
By volumes, yes, because you see, Rwanda started this in 2016, and 20 months down the line, they had done only 5,000 deliveries, the whole period, 20 months. If you break it down by the number of days, they were doing 8 deliveries a day. I think 8.3 deliveries, 8.29 deliveries per day. So less than 9 deliveries a day. So that is why I am very concerned that we have budgeted for 600 deliveries a day. And by the way, he said it is not a cost per flight. We are not paying per delivery.
Okay.
So contrary to what Dr. Nsiansari said, we are not paying. It is in the contract for the avoidance of doubt. We are paying a lump sum, fixed amount every month, whether we fly or we don't fly.
Is that unit cost that we are coming to? What's the problem with that particular part?
Okay, so if you go further down the table, it provides that there will be a payout of $11,000 when they deliver 15. They make 15 deliveries a day. That translates to $24 per 0.44.
I see.
Yes, per day. Now it goes on to say that when they do 50 deliveries a day, a minimum of 50 deliveries a day, they would receive $27,000. That would reduce to $18 a day. Then when they get to 75 deliveries a day, they will be paid $59,000. Now when you break it down, it becomes $26.22 a day. Now this is very odd. Then when they at full capacity, they are expected to do a minimum of 100 a day, and they would get $88,000, and that would break down to $29.33 per delivery. Now, in economics, the more you consume any item, the unit cost goes down.
Okay.
In this case, the more we are consuming, the cost is going up, which is very irregular.
Technology.
And I would expect, it is not technology, because you see, your fixed costs remain the same. So the more you consume volumes, the fixed costs remain the same, the variable cost will be changing, but you get to spread the cost over the fixed cost. So it should reduce. If it doesn't reduce, then there's a problem. It's a flaw. And that is that is what we have.
This is particularly interesting because we're told that this is supposed to be cheaper compared to what's even happening in Rwanda. And this is because of this cost effectiveness, we bargain for the very best in this country.
Point is that they never even told us how much it cost in Rwanda. Nobody knows how much it cost in Rwanda.
Okay, they didn't tell us, but
so,
they told
so
us
we won't be able to. So,
yes.
so it is their word that it is their word we have to take.
That's true.
But the point is that this is an anomaly of a table when you are building pricing. It is very irregular to have your cost going up as you consume more. Unit cost should be going down. Interestingly,
is it still the case that we will be paying them whether the drones fly or not?
Let me read to you the exact wording. And there's more to okay, yes. So it says the service fee is a fixed monthly amount, not a per delivery fee. In exchange for the service fee, health facilities receive unlimited access up to the available capacity limitation to delivery of any medical products within the delivery time commitment set forth. Accordingly, the monthly service fee shall be paid to Zipline, irrespective of whether the MOH fully utilizes the available capacity in any given month. This is a verbatim quote from the contract.
Does that make sense to you?
If I am a supplier,
yes,
this makes sense.
Okay, but I'm talking about, I'm interested in what my state, Ghana, is actually
exactly. So I'm speaking as an analyst who is looking at the contract and both sides. From the supplier's point of view, he wants security. The security is that you can tell me that you want to do 600 deliveries a day, but in actual fact you do only 5. And if I have budgeted and invested
Okay.
on the basis of 600 and you do only 5, it means I'm losing. That is why they didn't do per delivery. Because then if you don't do the number of deliveries, he's not able to recover. His payback period is going to go back. His return on investment is going to go down. So he wants to be sure that he's secured, and he gave us this.
If you are representing Ghana, could he have had a better option?
Listen, yes. Now, we said that this is, in the recitals, it is described as the first of its kind. It is not the first of its kind, even in Ghana.
Okay.
Now, in February 2016, the Huffington Post carried a news report where the UN Population Fund and Bill and Melinda Gates sponsored a project in Ghana where drones were used to deliver contraceptives to women in remote areas in Ghana. This is obviously not known to many, and it's surprising that the MOH would make such representation in a legal document as this, when this project couldn't have been without their knowledge.
I want you to take a break here. When we return from this break, we'll continue with the analysis of this particular drone project. The project which is supposed to fix medical supplies delivery problem in this country, fasten the pace, save lives as it's being tagged, and review it properly after this break. You welcome back to our front. My name is Raymond Dakwa. Today, the Vice President of the Republic of Ghana launched the all-important, very, very important drones delivery service, which is supposed to deliver some 148 or more than 150 different medical supplies to specifically hard-to-reach areas in this country. And this started in the eastern region to various parts. Already, we were told yesterday that the life of a man, 44-year-old, was saved by the instant delivery of some medical supplies he required at the point that he almost died. This is what is envisaged as the Vice President explained this project to us today. Now, beyond the fanfare, we're seeking to break down every single part of this deal, the contracting that gets into this particular arrangement, and seeking, among other things, to say, was your city saved? Were you given the best of deals? In any case, is this in the ultimate interest of the Ghanaian? Those are the questions we're seeking answers to. Prior to this, we'll be looking at some elements of it. Now, we've been talking in the last few minutes about what the payment structure is supposed to be. So how are they going to be paid? What we've learned so far includes, 1, we will definitely pay them whether they work or not. So whether the drones deliver drugs to anywhere in this country or not, we will pay them. The other element we also want to know more about is to do with, so what are generally the payment terms beyond the paying them whether or not they work or not in this case?
Okay, so clause 6.2 has a provision for an on-time payment discount, which says that if based on the payment terms we are due to pay on, let's say, the 1st of May, if you pay on the 1st of May, there's an $11,000 discount that is given to you. Now, that itself means that the cost is $11,000 more. So if you pay me when you are supposed to pay me, I'll give that $11,000 back to you.
I see.
That is what it means. Now, is that how to use an early payment discount? No. An early payment discount says that my payment terms are 30 days. If my 30 days is due on 1st May and you pay me earlier than 1st May, then the discount applies.
Okay.
If I'm paying you when it is due, then I haven't breached the agreement. So this is the price. So the fact that there's an $11,000 built in that says when it is due, I'll give you that one back, means that they anticipate that we won't pay. And so they've built that in. So it means if you miss it by 1 day, that 11,000 is lost. That means that 11,000 is a penalty.
Okay.
Now, on top of that,
was not really part of the cost structure in the first place.
It mean, that is what it is. Technically, if you are doing the cost analysis, that is what it means.
Okay.
So the real cost is whatever it is minus. So at full scale, the cost per month is $88,000. If we pay on the due date, they'll give us back $11,000. That means that the real cost is $77,000. So if you miss by 1 day, you have lost that 11,000. So that is it. That is a form of penalty. 10 upside down. Now there is a late payment penalty as well, which is 20%. Now here is my problem. Number one, this transaction is a dollar transaction.
Contrary to the rules we have set for ourselves in the Exchange Control Act.
So that is part of the bigger problem. So number one, in this contract, we have broken 2 critical laws of this country, and Parliament is complicit here. We broke the Exchange Control Act, which says that a company which is domiciled in Ghana cannot, should not quote, price, display, and all the synonyms you can use for it in foreign currency. It has to be in Ghanaian currency. Now, Fly Zipline Ghana Limited, which is the company that has been contracted, is a company that is domiciled in Ghana. So this contract should not be in USD in the first place. It should be in Ghana cedi, but it's been priced in USD. That is the first thing. The second thing is that if you've priced the contract in USD, what is the going interest rate? When you do a late penalty, and in UK there's a law actually on late payment. So if you delay payments, the law, because companies were taking advantage of suppliers, they passed the law to say that if you're a company and you delay payment, you pay X% as a penalty to the supplier whom you delay. So here, the LIBOR rate as of today is about 2%. Traditionally, in international transactions, when you set an interest or liquidated damages, it is LIBOR plus something. So normally it is between LIBOR plus 2 and LIBOR plus 5. So if LIBOR is 2%, plus 2 will make it 4%. Even if it is plus 5, it will make it 7%.
It won't go up to 20%.
It won't get anywhere to 20% because our local interest rates are high. It seems 20% is a regular interest rate in Ghana. But we forget that this is a USD transaction. So already we are paying $11,000 on top. Now we have a 20% late payment charge on any late payment. And that is a double whammy. And you don't do that. In the principles of damages or liquidated damages at law, the interest, what it seeks, the damage, an interest payment seeks to do is to put you in a place where you should have been. You are not supposed to profit from it. This one is going to create a huge windfall because believe you me, we know that our state is not going to pay on the due date. So that 11,000 will be lost. That one, anybody can take it to the bank.
Especially when we are saying that we are asking benevolent people to give us money to deal with these people. It's not as if we have made budgetary allocations for it ourselves. So until the people give us money, we will not be able to pay.
So that 11,000, we will lose it. And we will always end up being liable for this 20%, which is in the contract, which is overpriced. Now, here's again the question, the challenge I have with our bureaucrats and our technocrats who are in the public service. If I'm doing purely an assessment of my risks, it will be cheaper for the state to go to Bank of Ghana and borrow money at prime rate to settle this, even before the due date, than to go into liability.
Because the cost is too high.
Because the cost is too high. So why couldn't anybody engineer this into the contract to save us this kind of situation?
It's an interesting development there, and you also talked about the dollar thing. Can we change it now? Is it too late? Because if it's an illegality, you cannot legislate an illegality. You cannot approve an illegality, or Parliament can give us a bypass for that to happen.
So what will happen is that anybody who wants a derogation of the Exchange Control Act has to go to Bank of Ghana and apply. And then Bank of Ghana would give them the permission to receive either all or parts.
But we don't know whether Zipline did this.
I am not sure if they have done this. But it can be arranged. So don't be surprised if tomorrow morning there's a letter showing that Bank of Ghana has given that
through that particular process.
That is one fact. And then the other law that was broken is the Data Protection Act. And if you go, let me go down to that clause. Basically, what we have done is that we have given Zipline a carte blanche on what they can do with our data. And they can use it anywhere in the world, and we don't have any right to charge them any royalties or whatever it is. So we've given our entire data to them for free.
Does it contradict the Data Protection Act?
Yes. You can't take my data and use it without for anything.
But are they
without
taking
my
data of people?
So first point is that we have to check tomorrow morning with the Data Protection Authority if Zipline has been registered as an entity that can collect data. That is the first one.
Yeah.
If they are not, then that part of the law has been broken.
Okay.
Then the second one is that per this contract, we have assigned the data to them in contravention with the provisions of the Data Protection Act. So Parliament, by these two actions, the Exchange Control Act and the Data Protection Act, have breached this agreement, and these are material. And so it means this contract, if I take it to court today, it can be nullified.
The one that's already been rolled out?
Yes.
The one that's supplying blood already to save people's lives?
We can't decide to do something
contrary to established
which is
laws.
illegal.
Yes, of course. I mean, that's understandable. That's if they believe and understand so to be the case that it is clearly illegal. Now, the interest payments. The conversation we were having briefly about interest payments. Are we also being shortchanged in the interest payments arrangement, or we can't fix it in the course of, having to discuss it with the operators of Zipline and say that we made an earlier slight mistake in and we can easily get it fixed?
Yes. So a contract is between two parties.
Yeah.
And as long as the two parties agree to make any changes to a contract document, the two parties can make changes to the contract document. So yes, the two parties can sit down and agree that let's change this clause. So they will do an addendum to the contract and they'll say this provision here is replaced
but these parties included our Parliament. For example, if you want to make variations, can we change the price as of today without recourse to Parliament because the validity of the price has expired?
Yes. So as of the date Parliament was approving,
yes,
the validity of the price list you find in the contract today had expired.
Okay.
What it meant is that Zipline had the right to come back to say that, in fact, the prices will not hold anymore. It has to go up to this level.
And you now have to go to Parliament for that to be ratified?
There's nothing that says that they have to go back to Parliament.
But this is an international arrangement, or
yes,
is one time.
Once it's been approved, it's deemed to. But if the terms are going to change substantially, the right thing to do is to go back to Parliament.
Okay, but I mean, I think we are all more concerned about how much we're paying for it, and if the price can change, shouldn't that be worrying to us?
So I have said it, and I said it in my introduction that, listen, I am not against the use of drones.
Okay.
The use of drones should not substitute the regular cold chain management system.
Okay.
This is supposed to be an exception to the rule, not the norm.
I see.
What we are doing is to create this to be the norm, which makes it very, very expensive. Because even if it will take 3 days to get to Tumu, if you have a well-refrigerated truck and we provision and plan and move the items 1 week ahead of time under the right temperature, it will get to Tumu, and the cost per item will be cheaper than if you are flying it by drone.
Does it suggest to you that we did our own cost build-up? I mean, not from Zipline, but we sat down, reviewed, and actually felt that we needed to do our own simulations to find out how much is required, our own scenarios, analysis, and all the, infrastructure and all the things that we have to put in there. Does it suggest to you that we did our own?
With all the flaws you find in this contract and some of the side documents I've seen, for example, when the application was made to PPA for approval for sole source, and PPA granted approval, and PPA said that they should they should give us a discount, and the people said that is the best price they have given us, and we have no basis for accepting.
PPA never compared anywhere.
They never compared.
Because the PPA boss has told me here before that he never lets say any pricing regime goes without asking for a reduction or comparing elsewhere or doing their own analysis to ensure that this reflects the reality on the ground.
So in the letter I saw, if he had done any assessment, he should have told Zipline that, listen, on the basis of our analysis, we think this should be the price and not this. In the letter I saw, what he said was, Zipline made a very forceful argument for their price, and that is why we accepted it.
Not that our due diligence.
If he did it, there is supposed to be a due diligence committee or team in PPA.
Okay.
If they did, there should be a technical report that was done. They, by all means, they should make it public for us to see what was in it, and we can interrogate it and see whether they did due diligence or not. But in the absence of that, no. But
does that not surprise you? Of all the things that we have actually spoken about here, it sounds to many like this is a sweetheart deal.
This is a juicy deal. I mean, anybody should be happy to have a deal like this that you can see. Trust me, if
you have gloss over the financial elements, pursuant to the fact that this is life-saving, and we are looking at a bigger picture.
See, the first mistake we made is one: how many people are there in the market who can do this? I counted 10 that can do this. So it shouldn't have been so sourced in the first place.
Zipline should have been the only alternative.
It shouldn't have been the only alternative. Listen, JD.com, which is a retail chain in China, have been using drones to make deliveries to the remotest parts of China for years.
JD.com.
JD.com.
But I mean, you just mentioned too.
So there's Matanet,
okay,
which is the by far the most advanced of all the drone companies, yes, who are doing drone deliveries with Mercedes-Benz. DHL is doing drone deliveries. They are using the quadcopters,
okay,
and they are doing medical supplies in Tanzania, in Rwanda, and in the Caribbeans. So if we were minded to get the best value, we would have invited all these. There's another company called Fletty.
Okay.
So there are several of them we could have, and yes, that we could have invited to come and bid, and that itself would have ensured that we get the best of deals.
So even if the people involved in this case, that is the procurement authority, wanted alternatives, we could have asked these institutions for alternatives on pricing.
Yeah. So the practice in procurement is that if you are going to you are undertaking any transaction that you know you don't have too much experience, what you do is that you start with an expression of interest. That would allow the whole world to know that this is what you want to buy. Then all these companies will be aware that this is what you want to do, and they'll come and tell you that yes, we have capability for doing this.
Okay.
Then you can say, okay,
because we were told that because these are the only people doing it in Rwanda,
yes,
and Rwanda is also Africa, and that African countries may also play by the same book. There's none of these you mentioned.
But DHL is in Rwanda as we speak. They are in Tanzania as we speak.
Oh, I see.
Yes.
Doing medical deliveries.
They are doing medical deliveries. So Rwanda didn't do a sole thing. They wanted to. In fact, Rwanda, it is not a national coverage. It is only one remote part of Rwanda that they are doing this because it is remote. So they said do this as a pilot.
I see.
And then DHL is doing this as a pilot. We didn't do a pilot, which is normally what you do with technology purchases. You do a pilot, you see how it will work, and then you decide to scale up.
Now, let me understand this. We are losing money. We will lose money for what you just shown us. We effectively have a bad deal.
Yes, in my opinion.
Yes, we clearly seem not to have thought through this deal properly. Can we withdraw, we work and deal with later?
So you have allowed him to bring in equipment and resources and build a distribution center.
Okay.
If we decide to withdraw today, we have to pay him for the cost of all the equipment he's brought in. And by the way, they don't pay taxes per this contract.
They don't?
No.
Taxes not at all?
No, they don't pay taxes. If they pay, there's a mechanism for them to claw it back.
So we are procured an exemption of duty.
Yeah, so we've granted them. Yes, Parliament granted, as part of the approval, they granted them that exemption. And Parliament is the only institution that can approve exemptions from duties.
Does that make sense to you?
That's the unfair part. So you have companies coming from outside, and government is willing to give them tax incentives and tax. But local companies don't have this privilege. That's how we are discriminating against ourselves.
I see, and that's a bit more complex than I thought it would be under the very circumstances that we are looking at. So I was asking about what we could do under this circumstance.
Unfortunately, if we try to terminate this, we would incur some liabilities.
Can we review?
We can review this, yes.
The parties
and they
can
must
review.
Yes, Zipline should be willing to be flexible for us to review it to correct all
But
this.
Zipline that was not willing to change its pricing volumes and pricing scheme. Would it be available to do review?
Well, if the public makes a lot of noise and they come under public pressure, the government is under public pressure, they will have to back in.
Let's make this clear.
Otherwise, it is early days yet.
Okay.
The costs would not have been too much. It is easy to pay them off and let them go away, and we kill this.
We can cancel it.
We can, but at a cost.
We don't think it will be too much.
And we would have to evaluate the cost of termination.
Because you say it's early days yet.
Yes, it's early days yet. So it means they have to build 4 distribution centers. They've built only one.
Only one.
So it will be less cost than for allowing them to build all the 4 distribution centers, and now you have to terminate it.
Mr. Ata-Bedu, I appreciate your coming to us today, and my helpers appreciate the very details of this particular contract. Many thanks to you. We shall be following up on this particular matter. Well, folks, that's where we tie the nice rebates of today's edition of UPfront. Many thanks to you for joining us today.